A black nurse's urgent medical warning is dismissed by an arrogant doctor who believes his credentials outweigh her expertise. When the patient's condition spirals toward catastrophe, the nurse's ignored knowledge becomes the difference between life and death, and the moment that exposes a career built on ego. Rather than care, the ICU hallway smelled like disinfectant and fear at 2:17 a.m. Maya. Richardson's sneakers squeaked against linoleum as she intercepted Dr. Carson. Outside room 307, her scrubs were emerald green, her stethoscope still warm from her last patient check. "Dr. Carson, I need you to look at Mr. Bennett's vitals." He didn't stop walking. "I checked them an hour ago. They've changed." Maya's voice stayed level, professional. "His blood pressure's dropping, heart rate's climbing, and he's complaining of back pain that's migrating." Dr. Carson finally turned, his white coat crisp despite the hour. His eyes held that particular blend of exhaustion and irritation she'd seen too many times. "Nurse Richardson, Mr. Bennett has stable angina. We're monitoring him. If his condition changes significantly, the monitors will alert us." "They are alerting us." Maya gestured toward the room where amber lights blinked urgently on the cardiac monitor. "His symptoms don't match standard cardiac—" "I went to Johns Hopkins." Dr. Carson's smile didn't reach his eyes. "I think I can recognize a cardiac event." The monitor's beeping accelerated, a sound like a clock ticking faster. Maya's fingers tightened around the tablet in her hands. She documented everything: the patient's travel history, the unusual pain pattern, the subtle neurological signs everyone else had missed. Dr. Carson checked his watch. "If you're concerned, increase monitoring frequency. But I'm not ordering unnecessary imaging at 2 in the morning because of back pain." He walked away. His footsteps echoed down the corridor, confident and unhurried. Maya stood frozen, her clinical instinct screaming what hospital hierarchy wouldn't let her say louder. Through the window of room 307, she could see Mr. Bennett shifting uncomfortably in bed, his wife asleep in the chair beside him. The monitor beeped faster. Faster, she pulled out her phone, rewind 8 hours, 6 p.m. Memorial Hospital's emergency department hummed with controlled chaos as Maya clocked in for the night shift. She tied her hair back, checked her pockets, penlight, trauma shears, extra pens, and scanned the assignment board. 12 patients, 2 critical, 1 surgical consult pending. Maya. A new nurse named Jennifer rushed over, panic barely concealed. "I've got a patient in Bay 4 with chest pain and I can't get a clean EKG reading. Breathe." Maya walked with her, reviewing the chart on the tablet. "Is he anxious?" "Very." "That's your interference. Try repositioning the electrodes, and talk to him while you work. Calm patient, calm reading." Maya demonstrated the placement on her own chest. "Like this." "You've got this," Jennifer exhaled. "Thank you." Maya had worked at Memorial for 8 years, earning her place through double shifts and flawless assessments. She knew which doctors trusted nursing judgment and which ones needed their egos managed. She knew which machines malfunctioned under pressure and which pharmacists would expedite critical orders. She'd chosen emergency medicine because seconds mattered, because the difference between life and death often came down to someone noticing what everyone else overlooked. At 7 p.m., Dr. Marcus Carson arrived for his shift, 20 minutes late, designer coffee in hand. He barely glanced at the nursing staff clustered around the central station. His white coat was monogrammed. His stethoscope probably cost more than Maya's car payment. "Evening." "Dr. Carson," the charge nurse said. He nodded without making eye contact, already scrolling through his phone. Maya watched him disappear into the physician lounge. She'd worked with Carson for 3 years. Brilliant diagnostician, everyone said. Ivy League pedigree, family legacy at Memorial. His father had been chief of surgery for 2 decades, but Maya had seen the pattern. The way he dismissed suggestions from nurses, the way his eyes glazed over when women spoke, The way he never quite looked at her when she presented patient concerns. She turned back to her charts. 8 hours to go. She'd learned to trust her instincts over other people's credentials. Her grandmother had taught her that. At 8:47 p.m., the ambulance bay doors crashed open. 52-year-old male, chest pain radiating to jaw, history of hypertension. The paramedics wheeled the gurney fast, their voices clipped and urgent. Blood pressure 160/95, heart rate 108. Maya met them at the trauma bay entrance. Conscious? Alert and oriented. Pain started 4 hours ago while watching TV. Mr. Bennett gripped the gurney rails, his knuckles white. His face was grey, slick with sweat. I thought it was heartburn, he gasped. But it keeps getting worse. Maya's hands moved automatically, transferring him to the bed, attaching monitors, establishing IV access. Mr. Bennett, I'm Maya. I'm going to take care of you. On a scale of 1 to 10, how's your pain? 8, maybe 9, he winced. It's in my chest, but also my back. Between my shoulder blades, Maya paused. Chest pain radiating to the back, not the classic pattern. When did the back pain start? Maybe an hour ago. It feels like pressure. Like something's tearing. Jennifer worked beside her, hanging fluids, preparing medications. Maya documented everything, her mind already running through differential diagnoses. The EKG printed. Mild ST elevation, nothing catastrophic. But something felt wrong. Any recent travel? Maya asked. Camping trip 2 weeks ago, Colorado. Any tick bites? Injuries? No, nothing like that. Dr. Carson arrived, reviewed the EKG for exactly 12 seconds. Classic angina presentation. Start him on nitrates, beta blockers, aspirin. Cardiology consult in the morning. He started to leave Dr. Carson. Maya kept her voice neutral. His pain is migrating to his back. And he mentioned a tearing sensation. Angina can radiate. Carson didn't look up from his tablet. The EKG shows what we need to see. But shouldn't we consider... Nurse Richardson, I've seen 1,000 chest pain cases. This is textbook. He finally met her eyes. Unless you've suddenly acquired a medical degree I'm unaware of. A resident behind him smirked. Another nurse busied herself with supplies, avoiding Maya's gaze. Maya's jaw tightened. She turned back to Mr. Bennett, adjusting his pillow, her movements calm despite the fire in her chest. We're going to monitor you very closely, Mr. Bennett. His wife arrived 30 minutes later, clutching her purse, eyes wide with terror. Is he okay? We're taking excellent care of him, Maya said. She meant it, but her instincts screamed otherwise. At 10:15 p.m., Maya stood in the staff break room, staring at her reflection in the dark window. Behind her, the coffee maker gurgled. A fluorescent light buzzed overhead. The hospital hummed its endless rhythm, monitors beeping, footsteps passing, voices crackling over intercoms. She'd been here before. Not in this room, but in this moment. The moment when her clinical judgment collided with someone else's ego. The moment when her expertise was questioned, not because she was wrong, but because of who she was. Black woman, nurse, not doctor. Her grandmother's voice echoed in her memory. Grandma Esther had been a midwife in rural Alabama, delivering babies when black women couldn't enter nursing schools through the front door. Trust what you see, baby girl. Your eyes don't lie. The world might, but your eyes don't. Maya pulled out her phone. She'd photographed Mr. Bennett's chart. Every vital, every symptom, every timeline detail. She texted Dr. Yvonne Chen, a cardiologist she'd worked with during her first year at Memorial. Yvonne had left for a private practice uptown, but they'd stayed in touch. Need your eyes on something. Patient presenting with chest pain, but symptoms don't fit. Back pain, tearing sensation, pain migration. EKG shows mild elevation. Camping trip 2 weeks ago. Doc says angina. What do you see? The reply came in 90 seconds. That's not angina. Could be dissection. You need imaging now, CT angiogram. Who's the attending? Maya's stomach dropped. Carson, 3 dots appeared, disappeared, appeared again. Go over his head if you have to. I'm not joking, Maya. If that's a dissection and he gets standard angina treatment, he could die. Maya set down her phone. Her hands were steady, but her heart hammered against her ribs. She'd trusted her instincts before and been proven right. But she'd also learned that being right wasn't always enough. Sometimes the system protected the wrong people. She picked up her phone again and headed back toward the ICU. Maya had graduated nursing school on a Saturday in May, 10 years ago. Her mother sat in the front row of the university auditorium, wearing her best church dress, the ivory one with pearl buttons she saved for special occasions. She'd taken the day off from her job as a housekeeper at Memorial Hospital, the same hospital where Maya would start working 3 months later. Maya's mother had mopped these floors for 23 years, had cleaned the physician's lounge where Dr. Carson now drank his expensive coffee, had emptied trash bins in operating rooms where lives were saved by hands that never acknowledged hers. "You did it, baby," her mother whispered after the ceremony, holding Maya's face between rough, work-worn hands. "You broke through." But Maya had learned quickly that breaking through wasn't the same as breaking down walls. She'd worked night shifts during nursing school, studying in hospital waiting rooms, memorizing pharmacology on the bus. She'd chosen emergency medicine because seconds mattered, because she'd watched her father die of a stroke when she was 16, watched paramedics arrive too late, watched doctors miss signs, watched her mother's frantic explanations fall on ears that didn't quite hear her. "A good nurse sees the whole patient," Professor Williams had said during Maya's clinical rotations. "Not just the chart, not just the symptoms, the whole story." Dr. Marcus Carson had a story too. Maya had heard it in pieces, stitched together through hallway gossip and public records anyone could access. His father, Dr. Richard Carson, had been chief of surgery at Memorial for decades, a legend. Marcus had followed the expected path: private schools, Johns Hopkins, surgical residency. When his father retired, the hospital had hired Marcus immediately. But whispers followed him. Complaints from nursing staff that never quite made it to official reports. A surgical error covered up by his father's influence. A pattern of dismissiveness that turned into outright hostility when questioned. Money talked, power protected, and the system had a way of smoothing over inconvenient truths. Maya had filed one complaint herself 2 years ago, after Carson ignored her assessment of a septic patient. The patient had survived, barely. Maya's complaint had disappeared into an HR file, acknowledged with a form letter, never investigated. She'd learned to document everything, to trust her instincts, to fight battles carefully. Tonight felt like a battle she couldn't afford to lose. At 11:30 p.m., Maya sat in the empty conference room with her tablet and a cup of cold coffee. Mr. Bennett's chart was open in front of her. She read through every detail again, cross-referencing medications, allergies, family history. Something Carson had missed, something everyone had missed: the camping trip. 2 weeks ago, Colorado chest pain that started suddenly. Not gradual, not building, sudden. Pain radiating to the back, between shoulder blades. Tearing sensation. Blood pressure differential between arms that Jennifer had mentioned in passing. Maya's pulse quickened. She opened her browser, searched medical databases she'd bookmarked years ago. Aortic dissection mimicking angina. The articles loaded slowly, but each one confirmed what her instincts already knew. Type A dissection. A tear in the inner layer of the aorta, creating a false channel for blood flow. Symptoms: sudden severe chest pain, often described as tearing or ripping. Radiation to the back. High mortality if untreated. Often misdiagnosed as cardiac event because EKG changes can be subtle. Risk factors: hypertension. Connective tissue disorders. Trauma. High-altitude exposure. Colorado. High altitude. Maya's hands shook as she pulled up case studies. 3 patients, all misdiagnosed initially, all presenting with misleading EKGs. One had died within hours of receiving standard angina treatment. Nitrates that dropped blood pressure catastrophically in a dissecting aorta. She screenshot everything, saved articles, compiled the evidence into a single document. If Dr. Carson proceeded with his treatment plan, Mr. Bennett's blood pressure would drop. The dissection would extend, the aorta would rupture, he would die, and it would look like a cardiac event no one could have prevented, except Maya could prevent it. She was preventing it, right now. She grabbed her tablet and walked back toward the ICU. The hallway felt longer than before. Each step weighted with the knowledge of what she carried: truth, evidence, a patient's life, and the certainty that speaking up would cost her something. She couldn't yet. Maya found Dr. Carson at the nurse's station at 11:52 p.m., laughing with a resident about a golf tournament. She set her tablet down beside his. "Dr. Carson, I need 3 minutes." He glanced at her, then back at the resident. "Can it wait until rounds?" "No." Maya pulled up the case studies, the research articles, the symptom timeline. Mr. Bennett's presentation matches aortic dissection, not angina. The back pain, the tearing sensation, the camping trip at high altitude. You've been researching. Carson's voice carried amusement, not interest. "I've been doing my job." Maya kept her tone clinical, professional. "Look at these case studies. 3 patients with similar presentations, all misdiagnosed initially. If we treat this as angina and drop his blood pressure..." "Nurse Richardson." Carson set down his coffee. "I've been practicing medicine for 15 years. I think I know a cardiac event when I see one." The resident shifted uncomfortably. Another nurse pretended to organize charts. Maya pointed at the screen. "The research supports imaging. A CT angiogram would confirm or rule out. You read some articles online." Carson's smile was sharp. "That's not how medicine works. We don't order $1,000 imaging because WebMD scares us. This isn't WebMD. These are peer-reviewed. I'm requesting a cardiology consult for morning rounds." Carson picked up his tablet. "That's appropriate protocol. What's not appropriate is nursing staff second-guessing attending physicians based on internet research." Maya's voice stayed level. "I'm requesting a CT angiogram." The words hung in the air. The resident's eyes widened. The charge nurse looked up from her computer. Dr. Carson stared at Maya. "You're requesting?" "Yes." He opened Mr. Bennett's chart on his tablet, typed something slowly, deliberately. Maya couldn't see the screen, but she knew what he was writing. She'd seen it before in other charts, other complaints that disappeared. Nursing staff overreach. Recommend remedial training on appropriate chain of command. "Your concern is noted," Carson said. He walked away, the resident following like a shadow. Maya stood under the fluorescent lights, her hands gripping the counter edge. The station buzzed with activity around her, phones ringing, monitors beeping, the hospital's endless rhythm. For a moment, she let herself hope she was wrong. That Carson was right, that Mr. Bennett would stabilize, and she'd look back on this night as paranoia. But hope wasn't what kept patients alive. Evidence was. She picked up her tablet and headed toward the charge nurse's office. At 11:47 p.m., Maya did one more check on Mr. Bennett before her scheduled break. His wife was asleep in the chair, her head tilted at an uncomfortable angle, purse clutched in her lap. Mr. Bennett's eyes were closed, but his breathing seemed labored. The monitors showed what Maya feared, blood pressure trending downward, heart rate climbing. She checked his IV lines, adjusted the bed angle slightly, scanned his vitals on the monitor. Everything was sliding in the wrong direction. "Nurse?" Mr. Bennett's eyes opened. His voice was weak. "I don't feel right." Maya moved closer. "What kind of not right?" "Dizzy, and the pain, it's worse. Moving down my stomach now." His hand pressed against his abdomen. "Is that normal?" No, it wasn't. It was the dissection extending. Maya's hands moved automatically, rechecking pulse points in both arms, noting the blood pressure differential, documenting the pain migration. "I'm going to page the doctor." She stepped into the hallway and pulled out the phone. Paged Dr. Carson waited, no response. She paged again, marking it urgent. 2 minutes passed. 3. Maya called the charge nurse. "I need imaging authorization for Mr. Bennett in 3007. His symptoms are progressing." "Dr. Carson already assessed him tonight," came the reply. "If he didn't order imaging, we can't override that without another attending." "Then get another attending." "Maya, you know the protocol." "Unless it's a life-threatening emergency." The monitor alarm screamed. Maya dropped the phone and ran. Mr. Bennett was gasping, his face gray, his hand clutching his chest. The blood pressure reading flashed red. 88/52. His wife jolted awake. "What's happening?" Maya hit the code button on the wall. The hallway flooded with light and sound. Alarms, footsteps, voices shouting room numbers. The code team arrived in seconds. A resident Maya didn't recognize, 2 nurses, a respiratory therapist. Dr. Carson appeared 30 seconds later, his face tight. "Status," he barked. Blood pressure dropped, pain migrating to abdomen, patient in distress. Maya's voice was steady, clinical. "He needs imaging now." Carson pushed past her, checking the monitors, barking orders. "Increase fluids, push pressors, get cardiology on the phone. He needs a CT." Maya's voice cut through the chaos. "This is a dissection." Dr. Carson turned on her, his voice ice and fury. "Step back, Nurse Richardson. You're not the doctor here." The code team hesitated, looking between Carson and Maya. The respiratory therapist adjusted oxygen. The other nurses hung new IV bags. Mrs. Bennett stood against the wall, her hands over her mouth, tears streaming. "Please, someone help him." Maya met Carson's eyes. "If you don't order that scan, he's going to die." "Security." Carson's voice was calm, authoritative. "Escort Nurse Richardson from this room. She's interfering with patient care." The words hit like a physical blow. The code team froze. Maya stood her ground, her eyes on the monitor where Mr. Bennett's blood pressure continued to fall. "You're making a mistake," she said quietly. "Now." Carson pointed at the door. A security guard appeared. Tom, someone Maya had worked with for years. His face was apologetic as he touched her elbow. "Maya, come on." She let him guide her into the hallway. Through the window she watched the code team work, watched Dr. Carson give orders, watched Mr. Bennett's numbers spiral. Her phone buzzed in her pocket. Dr. Chen's message lit the screen. "Did you get the imaging?" Maya's hands shook as she typed back, "No." Carson refused. "Patient crashing." The reply came instantly. "Then he's dying. And Carson's killing him." Maya looked up. Through the window, she could see Mrs. Bennett sobbing, see the code team moving with increasing urgency, see Dr. Carson's face tight with concentration. She pulled up her contact list and dialed a number she'd never called before, hospital administrator. "Emergency line," someone answered on the second ring. Maya stood in the hallway at 12:03 a.m., her back against the wall, watching through the window as her patient died. Not yet. Not technically. But she could see it coming, the way Mr. Bennett's oxygen saturation dropped, the way his blood pressure refused to stabilize despite medications, the way the code team's movements grew more frantic. Tom, the security guard, stood beside her, uncomfortable. "I'm sorry, Maya, I'm just doing my job." "I know." Inside room 307, Dr. Carson barked orders, fluids, presses, more oxygen. Everything he was doing would work for a cardiac event. Everything he was doing would kill a dissection patient. Mrs. Bennett's sobs were audible through the glass. Maya's phone felt heavy in her hand. She'd called the administrator's emergency line 2 minutes ago. Left a voicemail. No callback yet. Another nurse, Lisa, someone Maya had trained 3 years ago, stepped into the hallway. "Maya, what's going on?" "Carson's treating a dissection like angina." Lisa's face went pale. "Are you sure?" "Yes." "Did you tell him?" "3 times." Lisa looked through the window, then back at Maya. "I believe you." She squeezed Maya's hand and disappeared back into the chaos. The hallway felt too quiet, despite the alarms. Maya thought about her grandmother, delivering babies in kitchens while trained doctors turned away black patients. She thought about her mother, mopping floors in this hospital while physicians walked past without seeing her. She thought about every time she'd been right and no one had listened. The monitor's alarm changed pitch. A sound every nurse knows means something. Catastrophic is happening. Maya's phone buzzed. The administrator calling back. "This is Director Patricia Walsh. You said this was an emergency?" Maya's voice didn't shake. "I have a patient in active aortic dissection being treated for angina." The attending refused imaging. "The patient is crashing. We have maybe minutes." Silence on the line. "Then who's the attending?" "Dr. Marcus Carson." Another pause. "I'm 3 minutes away." "Don't move." The line went dead. Through the window, Maya watched Mr. Bennett's wife collapse into a chair, watched the code team work, watched Dr. Carson's confidence begin to crack as nothing worked. She'd done everything right. Documented everything, presented evidence, followed protocol, and it still might not be enough. Director Patricia Walsh arrived at 12:07 a.m. in jeans and a hospital fleece, her grey hair pulled back, her eyes sharp. Maya met her at the nurses' station. Room 307. 52-year-old male presenting with chest pain 8 hours ago. Pain migrated to back. Patient reported tearing sensation. Recent high-altitude exposure. EKG showed mild changes, but symptoms matched dissection. Dr. Carson refused imaging. Patricia pulled up the chart on a computer, scrolling fast. "You documented all this?" "Everything, including my 3 requests for CT angiogram." Patricia's jaw tightened as she read Carson's notes. Nursing staff overreach. She looked through the window into room 307, where the code was still active. "How long has he been unstable?" 20 minutes. "Blood pressure's not responding to treatment." Patricia pulled out her phone and dialed. "This is Director Walsh. I need Dr. Okonkwo in the ICU immediately." "Override whatever he's doing. This is life-threatening." She hung up. "Dr. Okonkwo is chief of surgery. He's been investigating Carson for months." Maya's heart leaped. "Investigating?" "Multiple complaints from nursing staff over 3 years. All women. 4 women of color." Patricia's voice was tight with anger. "Every complaint buried by his father's influence. But Richard Carson retired 6 months ago. Things are different now." Through the window, Dr. Carson looked up, saw Patricia, and his face changed. Dr. Okonkwo arrived 90 seconds later, a tall man with graying temples and steady hands. He assessed the situation in seconds. "Maya Richardson?" "Yes, sir. Show me what you found." Maya pulled up her tablet, the research, the case studies, Mr. Bennett's symptom timeline. Dr. Okonkwo read fast, his expression darkening. "This is a dissection." "That's what I've been saying," Maya said. Dr. Okonkwo pushed into room 307. "Dr. Carson, step aside." Carson turned, confused. "I'm managing this code. You're mismanaging it." Okonkwo's voice carried authority that couldn't be argued with. "This patient needs a CT angiogram now." "Why wasn't it ordered?" "The EKG showed—" "I don't care what the EKG showed. Look at the symptom progression." Okonkwo pointed at the monitor. "Back pain, tearing sensation, blood pressure differential, high-altitude exposure. This is textbook dissection." Carson's face drained of color. "I made a clinical judgment. You made an assumption, and you ignored evidence." Okonkwo turned to the code team. "Stop presses immediately. We're taking him for emergency imaging. Prep the CT suite." The team moved instantly. Mrs. Bennett looked up, confused and terrified. "What's happening?" Maya stepped into the room. "We're getting your husband the imaging he needs. We're going to figure out what's wrong." Mrs. Bennett grabbed Maya's hand. "Thank you." "Thank you." They wheeled Mr. Bennett toward imaging at 12:14 a.m. Maya watched from the hallway as they disappeared around the corner. Dr. Okonkwo turned to Carson. "My office now." Patricia touched Maya's shoulder. "You did good. Come on." "Where?" "Conference room. You're going to tell me everything." The CT results came back at 1:23 a.m. Maya sat in the conference room with Patricia Walsh, Dr. Okonkwo, Dr. Carson, and a hospital lawyer named Stevens. The imaging filled the screen on the wall, aorta lit up in cross-section, the tear visible even to Maya's untrained eye. Type A aortic dissection, Dr. Okonkwo said quietly. Extending from the ascending aorta into the arch, another 30 minutes and it would have ruptured. The room was silent except for the hum of the projector. Carson stared at the screen, his face grey. "I didn't see, you didn't look." Okonkwo's voice was steel. "Nurse Richardson presented you with evidence 3 times. She documented symptoms you ignored. She requested imaging you refused. I made a clinical judgment based on the EKG. You made an assumption based on ego." Patricia Walsh opened a file on her tablet. "Dr. Carson, I'm looking at your record. 7 complaints in 3 years, all from nursing staff, all women, 4 women of color." Carson's lawyer leaned forward. "Those complaints were investigated and found they were buried," Patricia interrupted, "by Dr. Carson's father when he was chief of surgery. But Richard Carson is retired now, and this hospital's liability extends to every patient put at risk by ignored complaints." Okonkwo pulled up another screen. "October 2023. Nurse Jennifer Martinez reported you ignored her sepsis assessment. Patient nearly died. Your father intervened. Complaint dismissed." March 2024. Nurse Maya Richardson reported you refused her recommendation for surgical consult. Patient developed complications. Complaint disappeared. June 2024. Nurse Aisha Patel. "I get it." Carson's voice cracked. "But this was different. The EKG was misleading, which is why we don't diagnose based on single data points." Okonkwo's voice softened slightly. "You're a good diagnostician, Marcus, but you've let your ego override your clinical judgment. And tonight a patient almost died because of it." Stevens, the lawyer, cleared his throat. "What's the current patient status?" "In emergency surgery," Okonkwo said. "Vascular team is repairing the dissection now. Dr. Patel is operating. If everything goes well, he'll survive." "And if Maya hadn't pushed?" Patricia asked. "He'd be dead." Okonkwo looked at Carson. "The pressors you ordered? They would have extended the dissection. The blood pressure drop you were treating? That was the only thing keeping him alive. You were treating the symptom, not the disease. And you refused to listen when someone who knew better tried to stop you." Carson's hands shook. "What happens now?" Okonkwo exchanged glances with Patricia. "Medical board review. License suspension pending investigation. And a formal apology to Nurse Richardson." Carson looked at Maya for the first time all night. Really looked at her. "I'm sorry." Maya's voice was steady. "I didn't report this because you were wrong, Dr. Carson. I reported it because a patient almost died, and because somewhere there's another nurse trying to speak up, and another doctor who won't listen. This has to stop." Patricia nodded. "Effective immediately. We're implementing new protocols. Any time a doctor overrides a nursing concern, they must document the specific clinical reasoning. Those documents will be reviewed weekly by a committee. And we're mandating bias training for all physicians." "It's not enough," Maya said quietly, "but it's a start." At 4:47 a.m., Mr. Bennett came out of surgery, stable, alive. The vascular team had repaired the dissection, reinforced the aorta, and stopped the bleed before catastrophic rupture. Dr. Patel found Maya in the hallway. "You saved his life. If we'd waited another hour, he'd be gone." Maya nodded, too exhausted for words. Dr. Carson's license was suspended 3 days later. The medical board's investigation would take months, but the evidence was clear. Say a pattern of dismissiveness, a refusal to collaborate, and a near-fatal mistake that almost cost a man his life. 3 weeks later, Maya visited Mr. Bennett during his recovery. He was sitting up in a regular room now, eating Jell-O from a plastic cup, joking with his wife about hospital food. The color had returned to his face. His laughter sounded like life. "They told me you saved my life," he said when Maya walked in. Maya shook her head. "I just did my job." "You did more than that." Mrs. Bennet stood, tears already forming. "You fought for him when no one else would. You risked your career." "I risked nothing," Maya said. "I just refused to stay silent." Mrs. Bennet hugged her tight. Mr. Bennet reached out and squeezed Maya's hand. "I'm going home next week. Going to see my grandkids. Because of you." Maya walked through Memorial's lobby afterward, past the coffee shop where doctors gathered, past the administrative offices, past the hallway where her mother had mopped floors for 23 years. She thought about her grandmother's hands, delivering babies in kitchens when hospitals had whites-only signs. She thought about every nurse who'd spoken up and wasn't heard. She thought about Jennifer and Lisa and Aisha and all the others still fighting to be taken seriously. The hospital had implemented the new protocols: mandatory training on implicit bias, required documentation when overriding nursing assessments, a committee to review complaints. It wasn't enough. Systems changed slowly. But seeds were planted. Maya's phone buzzed. A text from Patricia Walsh, board meeting next month. "They want you to present your case. Are you willing?" Maya looked up at the hospital, the building her mother had cleaned, the building where she'd learned to trust her instincts, the building where a patient had lived. Because she'd refused to be silent, she typed back yes outside. The morning sun painted the sky royal blue, then gold. A new shift was starting. New patients, new challenges, new chances to fight for what was right. Maya tied her hair back, checked her pockets for her penlight and trauma shears, and walked back inside. She had work to do. Maya stood outside Memorial Hospital at dawn, watching the sky change colors. People kept asking her, "Weren't you scared?" The truth? She was terrified. But fear wasn't the opposite of courage. Silence was. In medicine, as in life, expertise doesn't belong to those with the most degrees or the loudest voices. It belongs to those who see clearly, who listen deeply, who refuse to let ego eclipse truth. Maya had learned long ago that being right isn't enough. You have to be willing to fight for it, even when the system is designed to silence you, especially then. Mr. Bennet went home to his family 4 weeks after surgery. He sent Maya a photo of him holding his granddaughter, both of them smiling. Dr. Carson's medical license was revoked 6 months later after the board uncovered a pattern spanning his entire career. He never practiced medicine again, and Maya, she kept showing up, kept speaking up, kept trusting what her eyes and her training told her. She presented at the board meeting, helped design the new oversight protocols, and mentored young nurses who reminded her of herself, brilliant, determined, and learning to use their voices, because sometimes the most radical act isn't saving a life, it's refusing to let someone die in silence. The hospital door opened behind her. A new nurse, young, nervous, eager, stepped out for air. "Are you Maya Richardson?" "I am. I just started last week. Everyone says you're the one who—" She paused. "Who stood up?" Maya smiled. "I'm one of many who stood up. And you will be too. Trust what you see. Your eyes don't lie." The young nurse nodded, hope and determination mixing in her expression. Maya walked back inside. The emergency department hummed with its familiar chaos. Monitors beeped. Voices called out. Lives hung in the balance, and Maya knew exactly what to do. Your credentials open doors. Your character keeps them open. And when you forget that, someone else will pay the price.